All right, today we're diving into a real double-edged sword in modern medicine. We're talking about a drug so powerful it can literally save your life from a nasty infection. But, and this is a big but, it could also come at a steep, permanent price. Let's get into the story of Moxifloxacin.
I mean, think about it for a second. What if the very weapon designed to protect you could also, well, turn on you? That's really the heart of the matter here, the big question we need to unpack with this powerful antibiotic.
So, you've got to be asking, why would any doctor risk it? Why use something so potent? Well, the answer starts with the enemy it's designed to fight. And we're talking about some really serious, sometimes life-threatening bacterial infections.
Yeah, we're definitely not talking about your average common cold here. Think more along the lines of a really bad community-acquired pneumonia, or some nasty complicated infection deep in your abdomen, or, and this is a big one, bacteria that have just decided they're not going to listen to the standard antibiotics anymore. For those kinds of fights, you really do need to bring in the heavy hitters.
And that's exactly where a drug like Moxifloxacin comes onto the scene. It was literally designed for these tough, knockdown, drag-out fights. You can think of it as a next-generation weapon in that constant war against bacteria.
Okay, so what is it exactly? Moxifloxacin is part of a really powerful class of antibiotics known as the fluoroquinolones. And it's a fourth-generation one, so it's a newer, more refined model. It's what we call broad spectrum, which is just a fancy way of saying it doesn't just go after one specific type of bacteria. Nope, it's designed to take out a whole host of different invaders, even some of the really stubborn, resistant ones.
So, how does it pull this off? What's the secret sauce? Well, its power comes from this really unique and, frankly, devastatingly effective strategy. It doesn't just hit the bacteria in one spot. It launches a two-pronged attack. Here's how this one-two punch works. First, the drug goes after an enzyme called DNA gyrase. Now, think of this enzyme as the thing that uncoils the bacteria's DNA so it can be copied. Moxifloxacin basically jams the lock, but it doesn't stop there. At the exact same time, it attacks another enzyme, topoisomerase IV. This one is like a pair of molecular scissors that separates the newly copied DNA strands so the cell can split in two. By blocking both, well, the bacteria is trapped. It can't uncoil its DNA to copy it, and it can't separate the copies. It completely shuts down its ability to multiply.
And the effect is just catastrophic for the bacteria. The analogy here is perfect. It's like you're trying to run a factory, but someone just came in and smashed the blueprint machine and broke the assembly line. The whole operation just stops, dead in its tracks, permanently.
So why is this dual action such a game changer? Well, for one, it's not just effective, it's absolutely lethal to the bacteria. And here's the really crucial part. Because it attacks two different systems at the same time, it makes it way harder for the bacteria to evolve resistance. See, a single random mutation isn't going to save it. It would need to somehow develop two perfect mutations at once to counter the attack. And the odds of that are, incredibly small.
Okay, so we know how it works. Now let's talk about what it's actually used for. And let me be clear, this is not your go-to for a scraped knee. This is a special forces antibiotic, reserved for very specific, very serious missions. And its target list is seriously impressive. It works against all sorts of bacteria. You've got your gram-positive guys, like Streptococcus pneumonia, a huge cause of pneumonia. Then it hits gram-negative ones, like E. coli. But here's a real key to its value. It's also effective against atypical pathogens. These are the sneaky ones that can often dodge other drugs. Oh, and it can even take out anaerobes, bacteria that don't even need oxygen to survive. It's got a really wide net. So what does that mean in the real world for actual patients? Well, it's a frontline choice for serious respiratory infections like pneumonia and sinusitis. It's also brought in for tricky, complicated infections in the abdomen and on the skin. And just to give you a sense of its sheer power, it's even on the list for treating things like plague and anthrax. Yeah, this is heavy-duty stuff. But, and you knew there was a but coming, with all of this incredible power comes a really heavy cost. This is the other side of that double-edged sword we talked about, and it's exactly why doctors have to be so incredibly careful with this drug. And you don't get a clearer signal of serious risk than this, a black box warning from the FDA. For those who don't know, that is the single most serious warning the FDA can put on a drug. It's their way of shouting from the rooftops that there's a risk of severe and sometimes even life-threatening side effects.
So what's in the box? Serious risk number 1, tendon rupture. And this isn't a minor thing. We're talking about disabling and potentially irreversible tendon damage. It can cause severe inflammation and even a complete tear.
The Achilles tendon is the one that gets hit most often, and the risk goes way up for older adults or anyone also taking steroids. All right, serious risk number 2, peripheral neuropathy. This is nerve damage, specifically in your arms and legs. And again, we're not talking about a little pins and needles feeling. This can be severe pain, a burning sensation, or major weakness. And the scariest part? The damage can be permanent.
And believe it or not, the list keeps going. Other major risks include some really scary central nervous system effects, like confusion or even seizures. They can cause a dangerous heart rhythm problem known as QT prolongation, and it's even been linked to an increased risk of an aortic dissection. That's a tear in the main artery of your body. So the risks are wide-ranging and very, very serious.
On top of all that, you have to be super careful about what else you're taking. Simple things like antacids or multivitamins with iron or zinc can actually block the drug from being absorbed, basically making it useless. If you combine it with certain other medications, like some antidepressants, you can dramatically increase that risk of a life-threatening heart arrhythmia. And if you're on a blood thinner like warfarin, it can seriously ramp up the risk of bleeding.
So, with all this, how on earth do doctors make the call? It all comes down to a very careful, very deliberate calculation, balancing raw power against necessary precaution.
Now, on the power side of the equation, there is one big practical advantage. It's convenient. The standard 400 milligram dose is just once a day. That simplicity really helps people stick to their treatment, which is a huge plus in fighting a serious infection.
But on the precaution side, there are some hard lines. There are people who absolutely should not take this drug. We're talking about anyone with a history of tendon problems from this class of antibiotics, anyone with known heart rhythm issues like QT prolongation, or patients with myasthenia gravis because it can make their muscle weakness dangerously worse. For these groups, it's a definite no-go.
And all of this really brings us to the bottom line. Moxifloxacin is, without a doubt, a valuable tool. It's a lifesaver. When you're facing a truly life-threatening infection, this is the kind of weapon you want in your arsenal. But it has to be reserved for those situations where the benefit of unleashing that power clearly, without a shadow of a doubt, outweighs the very real, very serious risks.
It really leaves us with that fundamental question that's at the heart of so much of medicine, doesn't it? When is a risk really worth the reward? With a drug this powerful and this dangerous, there's just no easy answer.